As with any hernia procedure, a simple and reproducible technique is key to an efficient and successful repair. ProGrip laparoscopic self-fixating mesh is a uniquely innovative product that combines mesh and mechanical fixation into one device. As a result, ProGrip laparoscopic self-fixating mesh provides fixation over the entire surface of the mesh, even below the inguinal ligament where tacks, straps, and staples cannot be placed. This video describes the suggested folding, insertion, and placement techniques for the ProGrip laparoscopic self-fixating mesh. We encourage surgeons to review this technique guide and utilize Covidien's lap inguinal trainer to familiarize themselves with the mesh and perfect their technique. Refer to the IFU for complete instructions. The following is a step-by-step guide to ensure a reproducible technique and an efficient and successful repair. Identify the side of the mesh with the microgrips that will engage the tissue. Confirm that you have the correct anatomical shape, left versus right. The green marking identifies the medial edge of the mesh. Make additional markings as necessary to help orient the mesh. Hydrate the mesh. With the grips facing down, fold the inferior flap up along the seam of the mesh. To facilitate later deployment, do not roll or press the layers of the mesh together. Fold the superior edge down and over the inferior flap of the skirt. Fold the superior edge down again. To facilitate later deployment, do not press the layers of the mesh together. Ensure the preperitoneal space is free of any extraneous tissue. When using ProGrip laparoscopic self-fixating mesh, it is important to completely dissect the lateral sidewall to ensure that the mesh lays flat. Grasp the lateral edge of the mesh along the two folds with a 5 mm grasper. With the lateral edge of the mesh grasped and the trocar angled out laterally, insert the mesh through the trocar towards the lateral preperitoneal space. Visually confirm that there is sufficient medial mesh overlap over Cooper's ligament and adjust the position of the mesh as needed. Using a blunt tip grasper, gently press the mesh into the tissue. Starting medially and working laterally, unfold the top edge of the mesh and gently press it into the tissue. Starting medially and working laterally, unfold the bottom edge of the mesh and gently press it into the tissue. If needed, perform additional lateral dissection to allow full deployment of the mesh in the posterior lateral space. Confirm the proper positioning of the mesh relative to the defect and anatomy. If necessary, reposition the mesh by peeling the mesh away from the abdominal wall, rather than dragging it across the abdominal wall. Once comfortable with the placement, use a blunt tip grasper to press the mesh into the tissue. Notice how the self-fixating grips provide fixation below the inguinal ligament, where tacks, straps, or staples cannot be placed. The ProGrip self-fixating microgrips ensure proper fixation to the tissue, even below the inguinal ligament, and ensures proper positioning of the mesh during desufflation.